Welcome, everybody.
Yeah, good evening, everyone. Thank you for joining us. You are in for a treat. The dynamic dietitian team is here at Unite for Her. And I'm just honored to be hanging with the cool group. That's what I'm honored to be.
We are just so beyond excited for tonight's speaker series, our nutrition focused treatment toolkit. We want to help you explore some expert backed guides that we have for chemo, surgery, radiation, hormone therapy to help give you some nutrition strategies to help prepare. So we have a great lineup for this evening.
Yeah, thank you, Aubrey, for leading the way. And, I think you guys all know the rules by now, right? So we have well over 50 that are attending this evening. So please keep yourself on mute. Use the chat. Tell us where you're coming in from. Use it to ask questions. We'll be monitoring the chat. I am the moderator for the day for this team, and we'll be able to ask that in real time, as soon as we have little breaks in size. So please use the chat as often as you need. And yeah, I think that's about it. Not too many rules for our wonderful speaker series. We know that all of this could not be possible without our incredible supporters and sponsors. And when I tell you, Erin is leading our team on the education platform, and we've delivered 41 speaker series, Ask the Experts, and virtual hangouts with key experts in the fields to help you just get what you need as far as that factual advice and the most top of mind topics where you're trying to understand what is new and breaking in the field. So a big shout out to those that are our presenting sponsors, Wes, Merck, Lilly, Gilead, and Novartis. We have gold support from GSK, Pfizer, and Daiichi Sankyo, and supporting sponsors of TerraSera and AbbVie. As you can see, that our list is growing, and we are so grateful because we continue to keep adding more and more to the Unite for Her Connect network. So thank you to all of those that are so dedicated to Unite for Her.
And we have some amazing events even upcoming beyond today from our education network. Tomorrow at 1 p.m. Eastern Time, we have an Ask the Experts inside the Unite for Her Care Box. So we're going to be talking about favorites from Lancaster Pharmacy, Jolene Hart, A Cure, and more. And then we are really diving right into September. I feel like Labor Day is going to happen so quickly, and then we'll be in September. We have a speaker series on September 4th at 5 p.m. Eastern Time for updates in ovarian cancer with Chief Surgical Officer and board certified gynecologic oncologist, Dr. Mark Shaheen. And then the 10th of September at 5 p.m. Eastern Time, we have a virtual hangout, Voices in Oncofertility, Insights from Patients and Providers, featuring Dr. Terry Woodward of the Department of Gynecologic Oncology and Reproductive Medicine. So lots of good stuff coming your way in the end of August and early September. You can always sign up and then submit your questions at uniteforher.org/UFHconnect.
Terrific. Wonderful. Thank you, Aubrey. All right, shall we get started? What do you think? We have a full.
I think so. I think so. And I feel like perfect. I will happily dive right in because I will be starting our four-part segment this evening for our nutrition focused treatment toolkit. So let me go ahead. I'm going to pull up my slides and share my screen. We're excited to dive in today because we really want to talk about the highlights of how nutrition can play a major role when it comes to just navigating these next steps in terms of whatever that may be for you and your treatment. Now, why does nutrition matter during cancer treatment? So, cancer patients are 1.5 times more likely to complete their chemotherapy as planned when they have medical nutrition therapy, meaning one-on-one consultations with a registered dietitian to create a plan as part of their care journey. So 1.5 times, that's a major increase. Malnutrition, which means lack of nutrients or maybe losing weight from lack of appetite or other issues, is present in 30 to 80% of patients. Now, of course, this depends on tumor type and treatment stage, but that's still such a large number. And then the most gripping thing that we talk about a lot in our wellness orientations too is that 72% of people report treatment related side effects. With that, 61% note that that impacts their eating and or drinking. So a large number of you, even on today, whether you are pre-treatment, actively in treatment, in maintenance phase, or post-treatment, you may have some side effects that you're dealing with. So today we want to dive in and talk about 4 treatments in particular. And that is because we have 4 comprehensive treatment guides available on our Unite for Her Nutrition Hub about surgery, chemotherapy, radiation, and hormone therapy, just talking about what we mean when we bring up these therapies, why nutrition may be important, and then also what can we potentially expect in terms of side effects or treatment related issues and how we can navigate those with nutrition. So, first on the list, we have surgery. So, I will dive right into surgery today. And when we think about breast and ovarian cancer surgery, surgery is often one of the first steps when it comes to treatment. So, that's why I think it's great to begin with that. So, for breast cancer, that may include a lumpectomy, so removing the tumor, maybe a small rim of tissue around it, or a mastectomy, which can be partial, total, or bilateral. Some women also go through reconstruction, whether that's implants or using your own tissue. And then there's of course various, types of these surgeries as well too. For ovarian cancer surgeries, we often have oophorectomy or removal of the ovaries, hysterectomy to remove the uterus and fallopian tubes, and sometimes in more advanced cases, there are debulking surgeries, which removes as much of the tumor as possible from the abdominal cavity. So these are all generally considered major surgeries, right? And depending on intensity of surgery and even area of the body, they can also affect things like digestion, metabolism, and overall nutrient needs. Whenever I'm connecting with members, I always like to ask what their surgery path looks like. And even if it's past tense, I always like to ask what that did look like so I can get a better understanding of where they're at when it comes to nutrient needs, recovery times, and things like next steps. Now, after surgery, it is very common to experience some nutrition related side effects. So, I do want to highlight a few of those today because I think sometimes we maybe have these issues and we don't always necessarily connect the two, or maybe we don't want to bring them up because we don't think they're too bad of an issue, but they definitely can be related to nutrition and nutrition can impact them as well. So, you may notice poor appetite or feeling full very quickly. Particularly, I think I noticed this with abdominal surgery. The stomach and the intestines don't move food along as efficiently. Also, pain medications can slow down digestion. So, this means you might feel full after a few bites. Even if you've only had a certain amount of calories or protein in the day, you still may have that early satiety. We might experience some digestive symptoms like nausea or constipation that can make eating more difficult. Nausea usually comes from something like anesthesia, but also can come from pain medications or even that slow digestion we were just talking about. Constipation often happens typically because of those pain medications, those opioid or other pain medicines. It gives us decreased bowel movement. And then usually, I think something I notice with a lot of folks is that around the time of surgery, we're maybe having lower fiber and lower fluid intake. 2 things that are key when it comes to moving things through our body, which is why that constipation may pop up. Fatigue often is something that's going to limit our energy, and not necessarily just to eat, although that's part of it, but also to shop, to cook, to prepare your meals. So the body is using such a tremendous amount of energy to heal your wounds and also to fight infection off throughout the surgery process and the healing process. So that can give you just less energy for these tasks that would be involved in nutrition. Sometimes wound healing can be delayed if you don't necessarily have the nutrients you need. Let's say if you don't get enough protein or vitamins or minerals prior to surgery, tissues may take a bit longer to repair themselves. So this causes increased recovery time and increased risk for infection. In something like breast surgery, where maybe there's removal of lymph nodes, right? Lymphedema is something we see. This can cause some fluid drainage, and that can be impaired, leading to some swelling in the arm or the chest area. And then also, depending on your type of surgery, there also may be just true changes to digestion or the digestive tract, right? Sometimes the debulking surgeries, they can temporarily or even permanently affect how food moves through the gut. So that might change your tolerance to fiber or fat, protein, portion sizes. So I think it's important to understand these challenges to help us plan nutrition strategies that make the most sense for you. So let's talk about preparing for surgery. Let's say we're pre op, right? We're getting our body ready for this next step of surgery. First, you have probably heard this 1,000 times and maybe also from your surgeon, but focus on boosting your protein intake. It is truly very important because protein provides that raw material for repairing tissues. It also helps to produce new immune cells, close your surgical wounds. If you go into surgery with lower protein stores, healing may be slower. Most people benefit from about 1.2 to 2 grams of protein for this preparation stage and beyond, thinking about recovery. Now, I know you're thinking, Aubrey, I don't know what my weight is in kilograms. It is just your weight in pounds divided by 2.2. So, for an average, let's say 150-pound individual, that's about 80 to 135 grams of protein per day. We want to focus on nutrient dense foods. Think like colorful fruits and vegetables, whole grains, lean proteins, healthy fats, because surgery is a stressor to the body. And antioxidants that are in colorful fruits and veggies and other nutrient dense foods can help protect tissues from oxidative stress during healing. Hydration, something you've also probably heard a ton of, very essential. Usually, I would say at least 8 to 10 cups of water per day, unless your doctor tells you otherwise for some sort of fluid restriction. Water helps to keep that digestion moving. So, thinking about let's prevent that constipation before it happens, reducing that risk, but also just supports circulating the nutrients through our body. So, we're getting the nutrients we're taking in to the places they need to go. We want to help manage inflammation and support immune function by including things like omega-3 rich foods like salmon and walnuts and flax seeds. It's also important just before you're considering surgery or going into surgery, if you have that time, to check for and correct deficiencies. Iron, B12, vitamin D are pretty common ones that I see, and correcting these in advance puts you at an advantage because your body doesn't have to work as hard during that recovery process. And definitely kind of lumping these last two bullet points together, but trying to limit ultra processed foods, high sugar foods, sugary drinks, alcohol, and smoking. All of these kind of together can interfere with healing and can cause increased surgical risk. So they can suppress your immune system, increase inflammation, and impair your wound healing. So we want to be mindful of some of these things that we want to maybe limit or be thoughtful about. But I think the large majority is things we want to increase, add, and be more mindful of that addition component. Now, you're not eating anything while you're actively in surgery. So let's talk about how to help recover after surgery. Definitely continue your high protein meals or snacks. So your body needs protein to rebuild that tissue, especially around the incision site. And then again, it's important for those immune cells. A lot of times I will recommend smaller, more frequent meals because digestion might be slow, appetite might be low. Smaller meals are just a little bit oftentimes more palatable and easier to tolerate. Anti inflammatory foods like herbs, spices, berries, dark leafy greens, nuts, seeds can help reduce swelling and promote wound healing. Fiber rich foods, once your bowels are moving again, they're going to help keep with that regularity, so preventing that constipation from recurring. We still want to hydrate. Fluids keep the tissue hydrated, help those nutrients to circulate, and keep preventing that constipation. And then, two other tips that I like to just mention. You want to ask for help where I think sometimes we don't always think to ask for help, and that's in stocking up on food, whether it's preparing food in advance for surgery or coming to cook a meal while you're recovering from surgery. Fatigue is so common, so having some ready to eat protein rich meals or smoothies or snacks that can help you from skipping meals that may mean you're not getting the nutrients you need. And last but not least, you definitely want to monitor for any warning signs if you notice you're not healing well, or maybe you're losing weight quickly or unable to meet your nutrient needs. Let's say you're really fatigued or don't have an appetite, you can't get into the kitchen. Make sure you reach out to your care team. There's so many avenues of nutrition support that can play a role in our healing and recovery. And nutrition, because it is so important to wound healing, we want to be really thoughtful about our ability to intake those foods that we need. So that's just kind of an overview of surgery, right? We can certainly prepare for surgery and give our bodies the best chance at a positive outcome, but then we also can help the recovery process for improved wound healing and just keeping ourselves feeling better. Now, a next step that I think is common for a lot of people is chemotherapy. So I'm going to pass it over to my colleague, Erin, who is going to dive into chemo.
All right. Thank you. Am I spot loaded? I'll have someone help me. Sue, the
I got
MC, if you wouldn't mind. You
you. Yep,
got me.
I got
Wonderful. Thank
you.
you. All
You got it.
right. So this is a big topic, chemotherapy, and I was monitoring the chat, and I know that we have at least one person here that is starting chemo. So, what can you do to prepare? What can you anticipate? And really, just as Aubrey was saying, how can you lean into nutrition to ensure your body has the nutrients to tolerate, to stay on track, to get stronger and recover afterwards? So, before we get into all of that, let's just start with a very high level introduction of chemotherapy in general and its purpose. So, overall, the goal of chemotherapy is to target and disrupt the growth and the spread of cancer cells. And it does this through various ways, depending on the type of medication. And I'll go over some types in just a moment. But it interferes with different stages of growth of cell replication. And it can also be used alone or in combination with other medications, depending on the type of cancer diagnosis, the type of cell, the size of that cell. So many variables go into that. But the goal overall is to strike a balance between eliminating cancer cells and sparing healthy cells to improve overall treatment outcomes and, biggest goal, improve the quality of life for patients. So know that as you move through chemotherapy, that is the overall goal. And chemo can be administered lots of different ways. So I think most commonly we think IV, intravenous, right? But you can also get oral chemotherapy. Topical is used often for skin cancer situations, and then there's localized injections that can happen. So, what are some of those common types of chemos, those broad types, and what are their mechanisms of action? Because I do think, at least very generally, understanding the medications that you're on and how they may be targeting your cell is worth knowing. So, one common type in the breast and ovarian cancer space is what's called an alkylating agent. So, this type of chemotherapy keeps cells from reproducing by damaging its DNA. So this includes your platinum drugs. Think carboplatin, cisplatin. They're often classified as an alkylating agent because they also work by damaging cell DNA, although they're not technically the same, but they work very similarly. So that's all of your platinum drugs. That also includes cyclophosphamide. And then we've got anti-metabolites. These work by interfering with both DNA and RNA by acting as a substitute for the normal building blocks of the cancer cells, RNA and DNA. Now, by acting as a substitute, they do not allow the cancer cell to replicate, and therefore it cannot reproduce. An example of this is Gemzar or gemcitabine. Now, we also have those anthracyclines. So these are what's known as anti-tumor antibiotics. Now, you hear the word antibiotics, it's not like the antibiotics we take when we have some sort of bacterial infection. But this class of medication works by changing the DNA from inside the cancer cell out, again, keeping it from growing and multiplying. And an example of this is doxorubicin. And then lastly, another large class of chemotherapy agents includes mitotic inhibitors, also known as plant alkaloids. So these work by stopping cells from dividing to form new cancer cells. They damage cells through all phases of replication by keeping enzymes from being produced. And because they don't have those enzymes, they can't create the proteins, and that is what stops that reproduction. And this includes all of the taxane class of medications. This includes docetaxel and paclitaxel, right? So now you may hear these big words, and your doctors are saying you're going to start this and you're going to start that. But I think it's really important for some of the more common agents that we hear from our community to give you a little insight in terms of how those agents are targeting the cells. Next slide. Now, with all of this, as Aubrey mentioned in the beginning, the majority of cancer patients will experience some sort of side effect as a result of their chemotherapy. And many of them, more than 50% we saw, include nutrition-related side effects. And what we most commonly see when we think of nutrition are those digestive, nutritional, sort of affecting the GI tract from top to bottom type of side effects. And I'll go through them in a minute. But the reason why we see these areas of the body so highly affected, it's because they are where we find epithelial cells. They line the digestive tract. Epithelial cells are high turnover cells. And so because they are rapidly turning over, they are more likely to be affected by chemotherapy agents. So when we see oral side effects like mouth sores, taste changes, mucositis, that can affect a person's ability to swallow, what they're picking up in terms of the food or the water that they're drinking. Appetite changes in general. One of the type of chemotherapy agents I didn't mention, but is often used alongside with some of those agents, are steroids. And I think most commonly we hear a person's appetite goes up because steroids are known to increase appetite. So appetite changes can be increased, but they can also be decreased. And then taking that from the oral upper GI tract, we're also moving through the digestive tract, right? So a person may experience reduced or loss of appetite, certainly nausea, vomiting, lower GI, diarrhea, constipation, and frankly, a person's side effects may vary from day to day. You may experience something one day, something else another day. So it's not unusual to see a little bit of ebb and flow. Along with this, it's not unusual to see some lab changes as well. We know many medications can affect not only electrolytes, but a person's blood counts. It's why you may be receiving injections to help keep your white blood count elevated or within normal range. So we know that there may be some lab changes, many of which we'll be asking you about, especially about those electrolytes. And I know we've got some additional information on our Nutrition Hub that can speak to some of those individual nutrients, but that can be a way that you can lean into food to get some of those electrolytes that we need: sodium, potassium, magnesium, calcium, that sort of thing. Now, the last two bullets here I threw on because while we might not innately think that they're nutrition related side effects, they do affect how we're able to prepare or bring food into the home. So peripheral neuropathy, again, we're thinking circulation to those furthest parts of our body, and they're affecting nerve sensation. Well, someone that's greatly affected by peripheral neuropathy, that affects how well they can hold something, hold a grocery bag, or carry a bag into the house, or how well they can hold a knife to chop something for dinner, or press a lid on for leftovers and put it in, or open a lid from the refrigerator, right? So all of those movements, we're thinking about how is that affecting a person's ability to eat, their interest in food, because if I'm struggling to get a lid off of a top, you know what? I don't feel like it. I don't feel like eating. We don't want you to get there. So we're thinking of all these other variables that could potentially affect a person's nutrition status. In addition, fatigue is huge. And in that study that Aubrey mentioned earlier, some of those statistics, one of the highest side effects that was reported is fatigue, and cancer-related fatigue we know affects every aspect of life, not only appetite, but a person's ability to grocery shop and prepare food and bring it into the home and clean up after meals. So there's so much that can be affected. So we want to help you strategize not only how you manage those side effects, but also these other things that could affect your ability to best serve yourself nutritionally so that you can better tolerate and recover from treatment. Next slide. So how do you do this? How do you prepare? There's lots of ways. The first thing that I always mention is speak to your oncologist early and often. I am an over communicator. I like to share everything with the people that are close to me, and do the same with your oncologist. Share what's important to you in terms of your nutrition and your health. Ask questions about what you may expect and stay in touch with them. If your nurse navigator is your closest confidant in your oncology team, or your medical oncologist, or a PA that you work with, just make sure you're staying in touch so they can be aware when things change. Focus on incorporating those nourishing foods, high fiber plants, lean proteins. And in fact, the dietary guidelines for Americans, the new version just came out for 2025 to 2030. And what I think is really fantastic about it is a greater recommendation to incorporate more plant protein foods as a means to meet your overall protein needs. You saw how important protein is for surgery. You'll see it extends through all of the varying treatments, but we can get that from a lot of different sources, from our animal and our plant sources. So leaning into those variables can really help you meet that goal. Hydration is key. It is so important to help us with allowing our body's natural detox organs to do their thing, essentially. But it also helps with just overall feeling well. If you're having some of those GI side effects, especially nausea, vomiting, or some diarrhea, fluid losses are increased. So we want to make sure that we are staying on top of that. General recommendation, very loosely, 60 to 80 ounces per day, but that number may vary person to person. So it's really important that you're communicating with your team or working with a dietitian, whether it's someone from our culinary RD team or an oncology dietitian at your oncology center, to really understand what your individual needs are. Maintaining your weight. So this is really important, especially for unintentional weight loss that is continuous. We know that, and sometimes I will hear from our members like, oh, it's okay, I have a little weight to lose. Okay, understood, but we don't want that number to keep trending down, because down the line, there are other things that may start to be affected. So a person has an increased risk of overall infection. They may not tolerate their treatment as well. There's a higher risk of having to pause that treatment. And we want you to stay on track. We want you to tolerate well. So maintaining weight is really, really important. Visiting the dentist. I am sure your oncologist has said, make sure you get your teeth checked. Your mouth is has a direct line to your heart. So you want to make sure before you're starting your chemo that your teeth, your dental health is in good care, and issues are addressed if they need to be. So definitely visiting the dentist. Stock up. And Aubrey mentioned this as well. I love this. So fill your fridge in anticipation, your freezer, your pantry, so that you have things that are readily available to you, so that you don't have to go to the store. You don't have to worry about those added steps. Fill them with nourishing foods, things you think that you can reach for when you're not feeling well, convenient foods that are nourishing but don't require a lot of cooking or standing in the kitchen, but just some easy reheating or take a minimal effort to put together. And then create a grocery list. I love this idea. So again, sort of leaning in, sometimes, you may have someone that's asking you, what can I do for you? How can I help you? What do you need? Well, grocery shopping is one of those tasks that can be the biggest weight off your shoulders. So keep that grocery list handy. So if someone says, how can I help you? You can say, listen, I need some things at the grocery store. I just don't have the energy to get out there, or I'm not feeling well enough to drive. But if you could pick these up for me, I would greatly appreciate it. So, you know, when others ask for assistance, it doesn't always have to be a big tray of lasagna, but it can be these individual tasks, going to the grocery store or doing a little bit of that food prep for you. Okay, next slide. So, lastly, how do you recover? So, how can you help your body work through treatment? And recovery is not just at the end of your entire regimen, but we know so often that many chemo regimens, you're going in for infusions every 3 weeks or every 2 weeks or every 21 days. So, even in between, how can you support yourself so that you can recover before your next treatment or before your next infusion? So, number one, take it day by day. And this is hard for many of us, right? But if you can sort of compartmentalize it and focus on how you're feeling today and managing today, it makes the big picture feel a little bit more manageable. So, if you're feeling unwell today, do the best that you can and know that in 4 days or 5 days or 6 days, where side effects may settle a little bit and your appetite may improve, you can leverage that time to get some more nourishing foods in. Support satiety. This is really important, especially when appetite is affected. So, prioritizing protein and healthy fats helps to keep you full, helps to provide you with good nutrient dense calories. So, even if the overall volume of food is lessened, it's meaningful with every bite. Plus, you're maximizing those nutrients that support maintaining lean muscle, recovery, our antioxidants like those healthy fats and those omega-3s. So it's helping to lower inflammation. So you're really making the most of every bite. Do not force feed. So during chemotherapy with appetite and taste fluctuations, this is a very high time for developing food aversions. And so if something that you might normally really love to eat, if it is sort of off-putting to you, don't force it. Reach for what sounds appealing. Pay attention to those changes in like taste and smell and some of our senses that we use when we eat, and how that may affect your food choices and how you can use that awareness to your knowledge that you can best tolerate your overall food. But eat what sounds good and be aware of food aversions. I even say some of my favorite foods, just hold off altogether because we don't want to ruin it for the long term. Again, leverage when your appetite is improved. So there are ebbs and flows between chemo treatments, and that is totally normal. And you can, again, use that to your advantage. So on the days when you know you're not feeling very well, okay, we're going to do the best that you can. But when your appetite is better, you can leverage that opportunity to focus on hydration, to focus on your proteins, getting in some nourishing fruits and vegetables, getting in a little bit more fiber, right? So really strategize the foods that you're reaching for, and that even provides you with a better sense of control. Prioritizing hydration, like I said, so important throughout this entire process. Hydration can be a challenge. The thought of even drinking water to some can be nauseating. So even knowing how you can add a little lemon or add a little citrus or add some mint or add a splash of cranberry in an effort to change the flavor profile to make it a little bit more appetizing can really be a tool you can keep in your toolbox. Shift that mindset. So this is a really interesting concept. Approach eating as part of your treatment, and this is your role to support your health and recovery. So sometimes just changing that mindset and saying, all right, this is my job. This is how I'm going to help myself. My team is doing this, and I'm going to support them by focusing on your nutrition. That can help to make it more approachable and to keep you involved. So even just changing the mind and that perspective for some can be really helpful. Moving in any way is known to have varying positive effects. In fact, I was just reading an article recently that walking has been shown to decrease nausea and has been one of the most effective things a person can do to help with minimizing that side effect. So any kind of movement is yields a positive effect. It doesn't have to be wildly active. You don't have to go running every day, but even a 10-minute walk, 5 minutes out, 5 minutes back, has been shown to help with appetite stimulation, can help to reduce anxiety, improves overall sleep, can improve overall treatment tolerance, and overall can help you feel better. And then finally, but I think the most important, connect with a dietitian. So work with someone individually that can help learn your a specific nutritional needs, what your experience is like, and really work alongside you to help you do your best, feel your best, recover your best through chemotherapy. So hopefully that is a little bit of insight. I know we've got 2 more treatments because we've got plenty more to cover. So we will be moving next on to radiation. And Aubrey, I'll let you pass that along.
You know what, Erin, before you leave, I have 2 questions for you, if that's
Sure,
okay. Hold right there.
absolutely.
Yeah, so we have one of our members just wondering, what are your thoughts on the protein powders, the bars, the flavored waters, electrolytes? It's just
Yeah,
the water more appealing for her, even
yeah.
allowing, the smoothies to just get some more protein in there.
Absolutely. I think all of those strategies could be effective. So, protein supplements, protein bars. I always say leaning into food first, but because we know protein as a macronutrient is so important, if you need to acutely add something like that in to help better meet your goal, that's okay. There's also ways that you can use whole food in things like smoothies to add a add a protein boost. We've got a really great blog on our website about that, but utilizing things like nuts and seeds, whipping in some tofu, using yogurt and kefir for some added protein as well. But for the time being, if you need to add in a particular supplement to what you're already doing, for the time being, that's fine. Electrolytes as well to add flavor or to help with supporting your electrolyte needs, especially, and I should say more specifically, in the instance where there's high fluid losses. So, not everyone needs an electrolyte replacement. So, if you're having a lot of diarrhea and you have those additional fluid losses, you may benefit from an electrolyte replacement on top of the electrolytes we get naturally from our food. Remember, we get plenty of sodium from the food that we're eating, magnesium, potassium, calcium. But with additional fluid losses, vomiting, diarrhea in particular, that additional boost may be warranted for sure.
Great. Thank you, Erin. We have one
Yeah,
more. And Angela actually was talking about how she has the orally disintegrating tablets of Zofran, and
yeah,
she can't get them in her mouth anymore. The taste is just too hard. And clearly, always talk to your doctor, Angela. But do you
absolutely.
have any suggestions? Have you come across that with any of our members where you had a little bit of a tip in order for her to get that tablet to get down a little
Yeah.
easier?
My first inclination for this is to hone in on oral health to start with. So, making sure that you're using an oral rinse daily to support overall oral health. Baking soda, salt, and water is something to do 3, 4 times a day. It can help with some of those oral and taste changes, but it's really supportive in creating a healthy oral cavity. So, you may want to start with just treating the oral cavity and the health around it first and foremost, and seeing if that can help better tolerate it. If not, I 100% agree with Jane. Talking to your physician. Is it something, magic mouthwash you could certainly do? Absolutely. If your insurance covers it, that can help with, from a prescription standpoint as well. So you could talk to that as well. But I would be hesitant about, um, you know, um, breaking it down in a liquid and swallowing it just because it's a medication and you want to understand how that may affect the efficacy of the medication, if at all. But I would definitely share that with your physician. And going back to that very first bullet, talk to your physician often and frequently so that they kind of understand what you're experiencing.
Yeah, great, Erin. Thank you.
You're welcome.
All right, Michelle, looks like you're up next.
Yeah, hi, good afternoon, good evening. And I feel at this point, we're going to start hearing some repetitive strategies, which is good. So some things to prepare for surgery and radiation, for chemotherapy and surgery, we can also do for radiation. So I will just dive right in and with the definition. So, radiation therapy is a treatment that uses high energy rays or particles to destroy cancer cells. So, for breast cancer, radiation is most often aimed at the breast, chest area, or nearby lymph nodes. It's commonly recommended after surgery to help lower the risk of recurrence by targeting any remaining cancer cells. For ovarian cancer, radiation is usually not part of the standard treatment. Ovarian cancer tends to spread throughout the abdominal cavity if it does spread. So systemic treatments like surgery or chemotherapy are usually more effective, but there are specific scenarios, very specific cases, like treating a recurrence in one area or to relieve symptoms like pain or bleeding. So, but typically breast cancer. So let's go to the next slide, nutrition related side effects. So radiation can affect the body in several ways, and some of these directly impact nutrition, as we've been talking about. So there it is again, fatigue, right? One of the most common side effects we hear with radiation. So that can make it harder to shop, cook, or eat regular meals because we're just too tired to do so, or maybe we're making something that's very quick and not as nutrient dense as we normally would. Um, Appetite changes can occur because of fatigue, nausea, or just a general change in how food tastes. So maybe let's reset our meal expectations. Instead of 3 large meals a day, consider having smaller meals and snacks throughout the day, such as half a sandwich, or keep snacks visible so they're easy to grab, like nuts or perhaps fruit. Nausea could be another side effect. We might not feel like eating, or we don't eat because we're afraid of getting sick. So if this tends to happen over time, if we are experiencing this nausea without talking to our physicians or healthcare team about it, it could result in a risk of nutrient deficiencies. So again, if any of these things are starting to occur, working with your healthcare team to make sure that you are getting the nutrition your body needs to keep healing. Skin irritation. So just especially in breast radiation, right, which can be painful and reduce overall comfort with eating, or it can result in less mobility. Like Erin mentioned with neuropathy, it could be painful to move a certain way and just too painful to prepare our meals. Taste changes are another possible side effect. Food may taste bland, metallic, or just different. So you may opt to not eat or just not eat as much. One of the things we can do is try to trick our taste buds, maybe play with our food, add herbs, spices, seasonings to bring out the flavor, adding an acid like lemon juice or vinegar, or something sweet like maple syrup or honey to bring out the flavor. Dry mouth can make swallowing and chewing difficult, which can reduce the enjoyment of food, or perhaps avoid some nutrient dense foods that are difficult to eat, like high fiber foods or high protein foods, just might not be palatable. So, all of these symptoms can make it challenging to maintain good nutrition, but being aware of them helps us plan ahead. So, how to prepare. So let's prepare for radiation. One of the best ways is to set yourself up for success. So there it is, adequate hydration. So aiming for 6 to 8 cups, or a little bit more than that of water per day, mostly unsweetened beverages. Remember that our fluids can also come from our foods. So broth-based soups, fruits like melons or oranges, and vegetables with high water content, such as cucumbers or zucchini. These can all help you keep hydrated when getting water in is just so challenging. Meal preparation is another great strategy. On days you feel that you do have some energy, or perhaps before you begin radiation, you can prepare and freeze soups, stews, baked goods, or other meals that can easily be prepared or reheated. Having, again, those easy to grab snacks available, trail mix, hard boiled eggs, or fruit. And this can make a big difference just to have that one thing already prepared on days when cooking just feels overwhelming or you just are too exhausted to do so. Another meal prep strategy Could be for our smoothies. We were just talking about the smoothies. So it's like, oh, but I got to grab this. I have to grab that. Try portioning your fruits and your greens into bags, like freezer bags. And then when you're ready to make that smoothie, you're just grabbing bags or containers and just emptying it in the smoothie. Add your liquid and press start. So that may be something that you can do if you're too exhausted to prepare something. And it's nutrient dense, quite obviously. So ask for help. As we mentioned, hopefully there's a support system out there, friends and family that you can spend some time when you are feeling well to get together, make all those meals, freeze them, have them as leftovers. That can go a long way. Supporting yourself during radiation. So, your lifestyle and nutrition choices can certainly help manage these side effects to help keep your strength up. So, focus on protein, including a protein and meal at each snack. So, foods like at each meal and snack. So, foods like protein, eggs, beans, poultry, fish. They can support healing and maintain our muscle mass that we tend to lose. And don't forget our plant proteins as well. So, beans, nuts, and seeds, whether it's an animal protein or a plant protein, make that a focus. Choose foods that are light and easy to digest. So, things like white rice, white bread, white pasta, crackers, bananas, oatmeal, well cooked fruits and vegetables. Those tend to be well tolerated when you're eating and you're not feeling well. And then on the flip side, try to avoid those fried, fatty, or heavily spiced foods that can worsen nausea or upset your digestive tract. And again, reset that mindset instead of 3 large meals, small meals and snacks throughout the day. This is easier on your digestion and can maintain your energy levels throughout the day. Beyond food, staying active is important. There's strong evidence that gentle physical activity like walking, stretching, yoga can help reduce fatigue. Lastly, avoiding alcohol and tobacco products and keeping caffeine to a moderate level. While a small amount of caffeine can help with energy, too much can cause dehydration and interfere with our sleep, which clearly we don't, we want to try to get as much sleep as possible for our healing process. So, radiation therapy can bring some challenges, but with the right preparation and strategies, many of these nutrition related side effects can be manageable. So, just some prep work, some hydration, choosing nourishing, easy to digest foods can all be so helpful as you embark on radiation.
All right, Michelle, I did have one question, and our audience, I love that everybody jumps in and gives advice because we really do learn so much from each other.
Yes.
One was just talking about dry mouth and any other tips that you have that you didn't even maybe lead into in detail that you can think of. One of our members just talked about watermelon is really good for hydration and some lozenges and
Yeah.
anything more you could recommend?
Yeah, so for dry mouth, absolutely leaning on our produce because a lot of hydration in our produce, but a simple solution, and I believe I know we have that on our website, the solution of the baking soda and the water that can be a mouth lubricant as well. Maybe the lozenges, like you said, but frozen fruits can work also, like sucking on some frozen grapes or even if it's like pineapple or freezing watermelon, anything to try to stimulate those glands to bring out saliva.
Great. All right. Thank you, Michelle.
Mhm.
Okay, and it looks like we're going to finish out with Catherine. Hi there, Catherine. How are you?
Good, thank you, thank you.
Mhm.
Yeah, so I will be talking about hormone therapy. Now, when we think of hormones in the first place, we love hormones. Hormones are great. Hormones is the way of our body to communicate with different organs and different tissues whenever they're not close to each other. So hormones travel through our blood and then they make it work. It's basically like texting, but for our body. So in an ideal circumstance, hormones working ideally, Their main function is to focus on growth, repair, and just balance everything out. So we have a lot of hormones because we have a lot of work to do within our bodies. Now, we are specifically talking about estrogen and progesterone because those are the ones that are related to breast and ovarian cancer. So, in that case, for those specific hormones, their main function is to help regulate our reproductive system. That would be our menstrual cycle, fertility, bone health in general, cholesterol balance and health, our mood, which is so important for every day, our energy, and even our body fat distribution. So it's a lot. They do a lot. They are normally helpful. That is why we have them in the first place. Now, what happens is that they can actually become a fuel for tumor growth. And that is why some breast or ovarian cancer cells have or that are known to be estrogen positive. It's because they have a receptor that it works like a lock. So it's kind of like the hormones have a receptor, and then estrogen kind of comes in and unlocks the lock. And then when this happens, it's turning on a signal that it's making the cancer cells grow and divide even faster, right? Because within their normal function is to grow, repair, and balance everything else. But it's kind of like it makes it go a little bit crazy. So that is why we then have hormone therapy, which is kind of in the sense of trying to control all of this overgrowth. So when we talk about hormone therapy, what it does, it's going to change or it's going to block the effect of these hormones that will are fueling the growth of some types of cancer. So the goal from hormone therapy is to starve the cancer cells, and that way they won't grow and continue to spread. So it's kind of like a pause or a block. And it's typically recommended or prescribed after surgery or chemo or radiation. It depends on what your treatment plan is. And it's more so to prevent a reoccurrence, or it can also be in junction with whenever there's an advanced disease, just to slow down some of that progression. It's typically prescribed for 5 to 10 years, so it's a lot. And then there are some side effects, and that's what I'm going to be talking about to help manage those because this is long term. And they can come in oral pills, injections, or it can even be surgical procedures. So the most common ones, and you guys can see it listed in the first one. So tamoxifen is a selective estrogen receptor modulator. So what that basically means is that this is it's blocking the hormone, the plug. So it instead of the hormone having that lock and then estrogen coming and then just opening up that thing that it's making it reproduce, it's the receptor here, tamoxifen, is coming and it's just blocking it. So it's not letting estrogen activate that cancer cell. We also have aromatase inhibitors, which would be things like anastrozole, letrozole. So what those do is that it blocks an enzyme that makes estrogen so that it creates estrogen. So what it ultimately does is just lessen the normal type of estrogen that is within our body. So what it meaning essentially less estrogen, less fuel for the cancer. And then the surgery type would be basically ovarian suppression. So that would be shutting down our ovaries so that it stops our body's going to stop creating estrogen, and then that lowers the levels drastically. And then we'll see what that means on the next slide. So these are some of the side effects that come because, like I said, hormones are very important and they do a lot. So because we're blocking or reducing the levels that we have in our body, then it's going to have an effect. So I'm going to try and connect everything so that it makes sense. And that way you can understand if you are struggling with some of these side effects, where you need to start. So first of all, it's bone loss and osteoporosis, and that happens because part of estrogen's job is to protect bone building cells, the osteoblasts, and then without it, there's going to be a faster bone breakdown. So then what we need to do to help the bone prevent any further breakdown, we need to make sure that we're getting enough calcium. If we need to supplement, include a calcium supplement, vitamin D, because it works along calcium and it helps the bone stay strong. Protein, because it's what makes our muscles. So we also want to preserve our muscles. Our muscles is what covers our bones. So if we have stronger bone muscles, we're ultimately going to strengthen our bones as well. So then making sure we have enough protein, and at the same time making sure that if we are able to do some weight bearing exercises to help with that, and then also avoid alcohol and caffeine to prevent some of that bone decrease as well. We can also see a side effect of just weight gain, and because of that body fat shift, so estrogen is also responsible for distributing fat, and then typically it would go into our hips or our thighs, but then when there is a lower level of estrogen within us, then that results into our our fatty tissue concentrating more on our belly area. And then that also means that there's going to be a little bit of insulin resistance. So, meaning that our blood sugars are going to be a little bit high, creating all of that chronic inflammation. So, what we want to do in that case to help with that is making sure you're emphasizing on balancing carbs. So, a portion control whenever we're having carbs, making sure that they are a high quality carb. So meaning that it has a lot of fiber, like whole grains, beans, things like that. Also protein, making sure that we're having lean protein, and again, that portion control. And if you guys can really see, exercise will also play a role in this case to help. There's also, because it's long term, there might be some cholesterol changes because estrogen, again, it is in charge of increasing our good cholesterol and decreasing our bad cholesterol. So without it, it does the opposite. Nobody's controlling that. So then we typically see an increase in bad cholesterol and a decrease in good cholesterol. So for that, we just focus on a heart healthy diet, and that just means nuts, seeds, thinking Mediterranean style diet, again, fiber, olive oil to help with all of increasing all of that healthy fats. And then hot flashes and night sweats. And this is a really, really big one. And that is because estrogen, again, plays a really big role in temperature control within our bodies. So whenever there's low estrogen, our body's still going to control our temperature, but it's just very, very, very sensitive. So any slight changes within temperature, whether it's outside or honestly within us, then that is just going to create a hot flash. Your body's just going to want to try and compensate, but it's going to be very extreme. And then that is why we also see it more accentuated at nighttime, because during nighttime, our body temperature just fluctuates a little bit more. And then because it's any slight change is going to trigger that hot flash, that's why we'll experience it a little bit more at nighttime. Now, for this, the things that we can do nutritionally is just avoiding common triggers that affect our body temperature, like spicy food, right? Like whenever we eat spicy food, it's like your mouth is burning and everything, and your ears get warm. So trying to avoid any type of spicy food that could trigger that hot flash. Alcohol, caffeine, all of those things could be triggers for hot flashes and make night sweats a little bit worse. And then making sure that you are hydrating properly, because if you're sweating a lot and you're having that hot flash, then you're losing a lot of fluid. And so making sure that you are plenty hydrated and focusing on all of these things. And then if you guys notice, a lot of these things, like Michelle said, they kind of go along one with each other, right? It's all focusing on green leafy vegetables. Fiber is a really big one for most of the things that we mentioned. Protein is also huge. So pretty much all of the things that we were able to discuss today align with each other. So make sure that you guys take a look at our nutrition guides. And then I think I have one more. I know we're really late. Okay. Okay, so how to prepare real quick, pretty much what I said, right? So in this case, because it might be part of your treatment plan to go on hormone therapy, then start doing the same. It would be the same before and while you're on hormone therapy. Now, before you can start including all of these habits of a balanced diet, rich plant foods, making sure you're getting enough calcium and vitamin D, talking about a supplement with your dietitian or with your oncologist. Start including some of those exercises, weight bearing ones, staying hydrated, and just focusing on all of those little things to make sure that you have a balanced diet. And then now after, right? So when you are already on hormone therapy, you might not experience the side effects. That would be awesome. Then if you do so, then you might want to focus on some of the other things that I mentioned that are more specific, whether if it's, if it's the night sweats, then focus on all of the avoiding all of those hot flashes triggers and everything else. But that is pretty much it for hormone therapy. It's a lot of like case by case, but those are some of the most common things that we've seen.
Great. Thank you, Catherine. I know we had one question just about, tell me all about those good healthy carbs. And um, Erin ended up putting a whole list in the chat. There are so many good ones out there, but you can take that one too.
Yeah, carbs are our friends. Sometimes they have a bad connotation, but if you think about it, a lot of the good vegetables are heavy in carbs, like corn, potatoes, which is always, so what would make that a high quality carb is making sure that we are focusing on the fiber within them, because that's going to help prevent those spikes in blood sugars, which is what we typically don't like from carbs. So for instance, with fruits and vegetables, making sure that if you can eat the skin off of it, or pairing it, right? Like I have a lot of patients that they want to do white rice. And then white rice does increase your blood sugars a little bit more. But then if you want to mix it up, do a half white rice, half quinoa, or mix it with vegetables, like the ones that come frozen. And it's just like an easy mix. And then you're adding, it doesn't necessarily have to be the complete swap. You can just make it better. And then do your typical, starchy or soft carb, which is what we call our soft white carbs, and then just make it better with adding something that is higher in fiber or higher in protein. They both work the same way.
Yeah, terrific. Thank you, Catherine. I know that we had a couple things in the chat just talking about how probiotics, one of the comments was is that she had just crippling diarrhea and she started a probiotic pill recommended. And then that was like a game changer for her and she wished she knew it ahead of time. Do you have any comments about that?
I can certainly touch on that. Yeah, I think probiotics are the good bacteria that we want to populate our gut microbiome. There's always going to be bacteria in there. Sometimes there's bad bacteria, sometimes there's good bacteria. A lot of times when we go through treatment, particularly something like surgery, we're often given like high dose antibiotics, especially to prevent infection, and that can really wipe out the good bacteria and just all the bacteria in our gut because that's the intention of an antibiotic. And so probiotics are that good bacteria that we want to populate our gut. Now, that could be in the form of a supplement because supplements are going to just get in a little bit faster and quicker, particularly if we don't like some of the probiotic rich foods, which is the secondary, which are typically our fermented foods. So things like miso, tempeh, sauerkraut, kimchi, kombucha, anything that's going to be fermented, it's going to have those live active cultures of that good bacteria. So I would say I usually recommend opting for a foods first approach with adding in probiotics, especially if you're currently dealing with diarrhea, because we don't necessarily want to drastically shift that microbiome. However, if you're struggling for a while, it's certainly something to discuss with your provider if the introduction of a targeted probiotic supplement, because they all do have different strains of bacteria. So discussing if there would be a targeted probiotic that would be helpful for you.
That's great, Aubrey. I know we even had some questions about what's the kind you would recommend as a probiotic. Do you have a certain brand? And I know it sounds like you really want them to talk to their physician.
I would say yes, generally. Sometimes it's like a general recommendation. I don't know about you all. I will say Floristore or Culturelle are two very like general. They're lactobacillus strains that are pretty general that are kind of effective for most. But I do think it is a good idea to always clear that with your provider. And like I said, there are different strains of probiotics that can actually help with different things, be it diarrhea, a C. diff infection, constipation. So you want to make sure you're getting the right bacteria for you.
Terrific. And then Erin, I saw you commented on Lelia. She had talked about Verzenio, and we have a whole series called Potty Talk. I think it's Lilia. Sorry about that. And this Potty Talk series, it's on our website. So if you even went on there, it's uniteforher.org/potty talk. And our dietitian team can walk you through as well. But there's all different types of just great tips and resources on how to deal with the side effects of diarrhea and how to really approach them in a nutrition forward, as well as almost a counseling and tapping type of meditative approach, just to try and quiet that mind, because the emotional stress of that can weigh on it as well. So there's a 5-part series there. And then lean in. You see our dietitian team, they are dynamic. I sit here always in awe of all 4 of them because they're such great public speakers. They always joke that they could talk to a wall very easily because they're used to doing it often when we're on Zoom, practicing and making sure that we're ready to present. But they really are dynamic, and they are here for you. And when I say that, like, here for you, there is no limit to how often you can reach out to them. Please use them. This is why we have 4 on our team at the Unite for Her community, and we want to make sure that you're getting all of your answers. These are always really good Q&As, right? Because you have their attention, you're able to ask your questions, you get the answer right away, it's personal to you. Well, you don't have to just jump on a speaker series or an Ask the Experts. You can pick up that phone or send an email, right? Okay, let me see if I have any other ones. I feel like there's a lot about the probiotics in here, but I feel like everything else was answered. Yeah, I think we're a wrap. That was fantastic. Thank you. Really well presented.
Of course. Thank you, everybody. And of course, thanks as always to our virtual education sponsors, West, Merck, Lilly, Novartis, and Gilead, with additional support from our global sponsors, Pfizer, GSK, and Daiichi Sankyo, and supporting sponsors, AbbVie and Tercera Therapeutics. And of course, don't forget to join us tomorrow for our Ask the Experts at 1 p.m. Eastern Time, going through our CareBox favorites.
Yeah, we love that. And then we have other ones on the 4th of September, the 10th of September. Please watch your email, your social media. We're always promoting them. Really important that you're knowing the topics that are front of mind, and then get into our library. There's so many topics there that we have done for the past now 5 years, I think, Erin. That is just such a robust library with all of the best experts that we've been able to bring on, including our dietitian team is on there as well. So thank you, everybody. You guys are terrific. I appreciate you all. And everybody have a good night. Thank you.
Bye, everyone.
Thank you.